This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning and welcome into Mon Health Talk. I'm Dave Wilson. Hope you're having a good start to your week. October is Breast Cancer Awareness Month, and we're going to be talking about breast cancer treatment this morning. Got a pair of guests on the show, so please welcome in. Dr. Qazi, Medical Director of Oncology for Mon Health Systems. Dr. Qazi, good morning.
Good morning. Nice to be here. Thank you.
And Dr. Kristen Statler, Surgeon of Excellence in Robotic Surgery at Mon Health. Dr. Statler, good morning.
Good morning.
Well, glad you guys could be with us. We'll get into breast cancer treatment as our subject this morning, but both of you have been on the show before, so you know, no matter how many times you've been on, you got to talk about yourself, at least just a little bit. So, Dr. Qazi, we'll start with you. Just tell us a little bit about your background and how you ended up working with Mon Health.
Sure. So I was born and raised in Charleston, West Virginia. You went to Nitro High School. Parents still live down there, so got family still down in southern part of the state. But went to Case Western Reserve for my undergraduate degree and did research in cancer there with Ireland Cancer Center. Then came back for all my medical training here in Morgantown, and been here ever since for about more than 20 years now. Came to Mon about 5 years ago. I was attracted by, from where my medical training, got to work with a lot of the doctors that are over here at Mon, and got to work with the excellent surgeons over here, and always had a great opinion of Mon and its service to the community. So it was an easy choice to come over here and work, and I've been it's been five years now. I've been enjoying it ever since. It's been a great place to work.
All right, Dr. Statler, a little bit about your background.
Well, I was raised right here in Mon County on the western end. I'm a Clay Battelle graduate, and I did my undergrad and medical school training at WVU, and then I went on to CAMC, which is now Vandalia Health in Charleston, West Virginia, to do my surgical training. And then I chose to come back to Mon Health. It's where my dad was born. It's where I was born. It's where both of my children have been born. I couldn't imagine working anywhere else, and I absolutely love it. I have to tell people, I love it when patients come in and say, we've been here forever. I feel the same way. It's just home.
Well, glad to have you both on the show. Like I mentioned, October is Breast Cancer Awareness Month. Last week we talked a little bit about detection and getting those screenings, how important those are. So let's kind of pick up the conversation this week talking about breast cancer treatment. I'll let either one of you kind of pick up the conversation here. So after a patient has been diagnosed with breast cancer, where does the journey begin?
Dr. Tyler, do you want to start with that?
Sure. So kind of like you talked about, really the journey began when they went in for their screening. Somebody's reviewing that screening, and if it requires additional images and or biopsy, then usually one of the surgeons gets notified. In my case, a lot of times before you even meet me, I've already reviewed images and, if necessary, ordered a biopsy, usually done by radiology. And then when we have a diagnosis of breast cancer, you'll get a phone call, and I call my patients personally and talk to them about what we found and have them come into the office to see me. Encourage every patient. This is a life-altering event, and I know that. So I encourage every patient, please bring family with you. Let's sit down and talk about what we found and what your options are for treatment. It's going to be a group approach. It's not just the doctor telling you what's happening. It's going to be your decisions, your family, and there are going to be a lot of doctors that get involved in care. So another person that you might talk to along the way is our breast cancer navigator, who's going to reach out and kind of let you know that they're there and available, and there are a lot of options going forward, and we're going to help you however we can to make the journey as smooth as possible.
And Dr. Qazi, before we get into the types of treatment, what type of factors or variables will go into deciding the best course of treatment?
So, like Dr. Statler said, this is definitely a team approach here. We have a multidisciplinary tumor board here, and we discuss a lot of cases there. obviously, we, Dr. Statler, Dr. Burns, Dr. Tallman, all of the great surgeons that are here, we know each other. We talk to each other on the phone and, through text. And we definitely, will discuss these cases, to decide what is the best course of treatment for each patient, each individual patient, prior to even, surgery or, chemotherapy that may be needed. And that's always, a very individualized approach. As cancer, treatment has evolved, really we are getting to this point in time where we're doing what we call personalized, cancer care. So what that means is really according to the individual genetic underpinnings of the cancer, we're trying to treat that, to the best of our abilities, and going by the molecular markers and so on and so forth, we are personalizing that care for each person. And that really is really the key of, getting the excellent numbers we have in cure and getting people into long-term remissions for their cancer. And that's why, we have such great results now with breast cancer.
So what types of treatment are available at Mon Health?
So, like I said, we definitely utilize all the different disciplines for breast cancer. Obviously, Dr. Statler is an excellent surgeon. She offers different types of breast conservation surgery, total radical mastectomies, and then obviously the reconstruction options. We do on our side, obviously the medical oncology side, we do chemotherapy and targeted treatments. We do them sometimes even before the surgery to help shrink down the tumors themselves before the actual surgery, so that it's an easier surgery. Sometimes the actual cancer can be completely obliterated before you even get to surgery, and that obviously helps with overall survival with these cancers. We also utilize our radiation oncologists. Radiation therapy is still very important in the overall treatment of breast cancer. And then, for people who have advanced cancers, we do have, the latest cutting-edge technology and antibody drug conjugates and different types of non-chemotherapy options now that are available for breast cancer, which are obviously easier than the traditional chemotherapies that we had before, just as the only treatments for breast cancer for the more advanced cases.
And before we get to our first break here, Dr. Statler, as far as surgical options go, can you explain kind of what's the range that's available to treat breast cancer?
Absolutely. So, again, this is a patient-specific choice in a lot of cases. We have lumpectomies versus mastectomies and reconstruction. Some women choose to do a lumpectomy, which a lot of times will include radiation afterwards. A lumpectomy means we're just taking out the area that is diseased with tissue around it. And then there's mastectomy, and mastectomy means taking the entire breast. And some women are more comfortable with that as an option. We know clinically now with all the research that a lot of times a lumpectomy is as effective at treating cancer as a mastectomy. But when a patient comes into me, I still tell them it's up to them what they're most comfortable with. It doesn't matter what all the numbers say. It's what the patient feels comfortable with. And then there's reconstruction, and some women elect for reconstruction. Some elect to do non-reconstructive, and we have options for people who choose not to have reconstruction to have wearable prostheses. So there are a ton of options out there for women as long as they're comfortable with the decision that they've made.
I lied. One more question before we take the break. When it comes to surgery, Dr. Statler, how I don't know if invasive is the right word I want to use, but are we talking about, are most of these, are these same-day surgeries? Or are you going to spend a night in the hospital? Just what does that entail?
Well, so a lot of these are same-day surgeries. Occasionally we'll have a patient spend the night if it's a massive surgery with a lot of reconstructive changes. But nowadays, you come in that day and you get to go home the same day. Within 2 to 3 weeks, most women are back to doing most of their normal activities. So we try to keep this as least invasive as possible. Now, to be honest with you, most surgeons are not doing robotic surgery for breast care yet, but we do oncoplastics, meaning that we try to cover up scars and make it as well-looking as possible, I guess is the best way to say it. But we still are able to do all this as an outpatient procedure.
Dr. Kristen Statler, SRC Surgeon of Excellence in Robotic Surgery at Mon Health, and Dr. Qazi, Medical Director of Oncology for Mon Health System. They are our guests this morning. We're talking about breast cancer treatment. We'll continue that conversation in just a moment. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Dr. Qazi, Medical Director of Oncology for Mon Health Systems, and Dr. Kristen Statler, SRC Surgeon of Excellence in Robotic Surgery at Mon Health. And Dr. Qazi, when it comes to breast cancer treatment, actually cancer treatment in general, it's not your grandparents' treatment anymore. Can you explain how the treatment, when we're talking about radiation, some of the other treatments, it's much more focused these days than maybe, say, 15, 20, 25 years ago?
Yes, that is exactly right. Over the last 20, 30 years, we've seen such great improvements, both in like you just said, for radiation therapy, and in the application of chemotherapy as well. In the radiation side of things, we have been able to really focus the amount of radiation, and by using the modern type of living accelerators that we have here at Mon, basically what they do is they really minimize the damage to the normal tissue, right? And obviously, you're really trying to target the actual cancer over the normal tissue, and so not only by just having a really fancy machine to do that, but they also now we know other techniques that actually can help move, sometimes be able to kind of move the normal tissue away by putting catheters in our bladder, balloons in, or something like of those sorts. To sometimes we even use we'll even have to keep the ovaries for a female patient. Sometimes we'll actually have them have the procedure done where they're farther away from the radiation field. So there's so many different ways now we can actually intervene, and do radiation therapy, and really try to spare, the bad consequences of exposure to normal tissues. Again, on the side of chemotherapy, we really made such, vast, improvements. Now, many treatments actually we don't even use chemotherapy at all. For certain cancers, we don't even, we're able to use targeted treatments, and these obviously have a lot less side effects. Immunotherapy, even in now breast cancer, we use immunotherapy where we are using these very, pretty easily tolerated agents that just supercharge the immune system to go fight the cancer like it normally should. And so, people who are getting those treatments, they don't feel like they're getting anything at all. But they actually absolutely have great benefit from having these treatments. And some of the really bad breast cancers that we saw before, these triple-negative breast cancers, we are seeing tremendous response to these new treatments, and patients are living longer, and they're living better without those really bad side effects.
Both of you have kind of hit on this already, but I want you to expound on it just a little bit. The comprehensive approach, we'll start with you, Dr. Qazi. A patient comes in, they've been diagnosed with cancer. You've talked about, or breast cancer. You've kind of talked about already this team approach. So who all is involved in the comprehensive approach, and what are each of their roles?
So, like we said, now, each one of these professions, whether it be we have surgery, we have the medical oncology, we have the radiation oncology, and each one of these, we'll spend a lot of time with our patients, kind of navigating through this. Luckily, we do have, like Dr. Statler mentioned, we have a nurse navigator for breast cancer who kind of helps start that out. So Kathleen Jerzak's our nurse navigator for that right now. She does a great job. We also have nurses and financial navigators who also interact with our patients. We also have another really important part now, and we're really learning about the importance of rehab and exercise and diet, and not only just alleviating some of the aspects of cancer, but also in the long term in survival rates. We are really expounding the use of rehab, and so we have a partnership with HealthWorks, the Revival program, to offer physical therapy that is specific for cancer patients, especially for breast cancer patients. So there's a huge team that works very much in tandem with each other. We have great infusion nurses. We have, all of our offices have, people who are dedicated to navigating, our patients through this very complex and long-term process. And, that's one thing that I really am proud of that Mon does very well, is take patients through all of these different specialties and gives them a comprehensive care approach.
Dr. Statler, when it comes to surgical options, what are some of the factors that patients consider? Is age a factor, risk factor a factor? It's kind of redundant, but you get my point. What are some of the things that you'll talk to your patients about when choosing their surgical options?
Absolutely. So we always talk about age, and a lot of times age isn't a factor necessarily so much in the surgery itself, but in the risk of recurrence. How long are we going forward? Some women who are younger say, well, there's a slight increased risk in breast cancer coming back in a lumpectomy versus a mastectomy. It's very small, so it's not really something that we say is significant, but enough that a woman might say to me, well, I'm in my 40s. I want to go with a mastectomy because I know that's less breast tissue. The risk of recurrence is slightly smaller, and we're talking less than a percentage point. But most of my women, it's just their comfort level with whether or not they want conservation. Some women feel very strongly that they want conservation to keep as much normal breast tissue as possible, while others don't feel that, and that's fine. It's very personalized. The biggest factor, and I talk to all women about this, is the size of the tumor. So if we find a large tumor, we'll definitely need to do some treatment up front, and Dr. Qazi and I always talk together, but we need to do treatment up front to try to shrink that tumor as much as possible so that the cosmetic result at the end is the best possible result. If it's a 5-centimeter tumor, if we can get it down to a 2.5-centimeter tumor, then most of the breast is left intact after that. So I think for most patients, that's the biggest choice, is whether or not they want a cosmetic lumpectomy versus let's do a mastectomy and start from scratch and rebuild the breast tissue.
Got a couple of minutes left here with Dr. Qazi, Medical Director of Oncology for Mon Health System, and Dr. Kristen Statler, SRC Surgeon of Excellence in Robotic Surgery at Mon Health. Dr. Qazi, when should women start getting mammograms?
Yeah, that's a good question. And, there are I think, just for patients out there, there are different organizations that give different recommendations. So, don't be surprised if you hear things, slightly different opinions. But mostly, here we go by the general American Cancer Society recommendations that we really, encourage women, especially because in the Mountain State we do see a lot of early breast cancer. So I think, for our area, we do recommend women around age 40 to really start, and that's if they have, no really significant risk factors, but really consider starting getting their mammograms at age 40. Obviously, if they're higher risk, you really then really need to start that. If you have a first or second degree relative or other things that consider, to be high risk, and that really goes through. And sometimes, for younger women, we had to use other modalities for sometimes for their imaging, but in general, we do recommend age 40. And then again, it's definitely you have to talk to your healthcare providers, your PCPs about establishing that risk, and then and then getting the appropriate screening mammogram and at the appropriate interval too, whether that be every year. Usually we do. ACS does recommend annual mammograms. But sometimes you can't do every 2 years. But again, I think for the women in this area, because we do have a higher risk of it, and definitely younger populations, we do recommend the age 40 and every year.
And Dr. Statler, go ahead.
I was going to say it's never too early to start your self-breast exams, even though it's kind of fallen out of favor with some of the colleges, the American colleges. I still tell women, you know your body better than anybody. So once a month, check yourself. And if you feel anything, don't hesitate to come in and talk to one of us. It never hurts to check.
100% agree, 100% with that.
We've got about a minute, so we can't touch on all these, but can you give us an idea of the support services that are available for cancer patients at Mon Health?
Yeah, I'll take that. We actually are really, really blessed. We have an amazing nurse here, Patricia Julian. She has been an amazing resource here. She has put together a wonderful, like fully stocked wig bank, a bra bank. She puts together the series, a talk series for patients. They're called the PB&J series, the Preserving Brave and Joyful series, which helps patients navigate some of the emotional and lifestyle kind of changes that come with a breast cancer diagnosis. And really, we just have wonderful staff like her in our infusion center that really just help our patients out. We have a financial navigator that helps make sure that the costs are not being too overwhelming for patients and gets help and grants for that as needed. So there's just a lot of great people here who really are working to keep people in the community, whole and healthy.
Dr. Qazi, Dr. Statler, thanks so much for joining us this morning. And, of course, always you get more information at monhealth.com/cancer. Guys, thank you so much.
Thank you.
Appreciate it.